staffing needs and our plans are really based on LA County guidelines right now. We're focusing on one-to-one patient care with appropriate PPE for us and our patients at all times. We try to stay indoors no more than 15 minutes. Our attempt is to always get them in and out as quickly and as safely as possible to minimize the potential for infection, to both parties, ourselves and our patients included. At any time, we try to keep our patient load in our 1,000 square foot facility down to 2 patients and 2 athletic trainers. By doing that, we keep social distance. We have 2 tables that are approximately 15 feet apart, doing any type of evaluation and quick treatment that we can do in a safe manner, and whenever possible, releasing them outside to do any type of treatment we can safely do outside.
So staffing modifications, we are obviously looking to implement more of a rotation with the professionals and the students that work in the athletic training room. As far as athletic training needs, we're going to change some of the stuff that we order. We're not going to be doing as much taping as we have in the past. So obviously we're going to need less tape than we have previously. A lot more PPEs, hand sanitizers, gloves, masks. So all that stuff will be, we'll have to supplement that more so now than previously.
The modifications we have made in our athletic training staffing plans, unfortunately, was out of our hands. In the beginning of the pandemic, during the summertime of the month of May, June, and July, our athletic training staff suffered a couple of hits in terms of furloughs and layoffs. Fortunately, we got through that okay. We are staffed with 3 full-time athletic trainers, 1 graduate assistant athletic trainers, which for the model of what our sport activity is currently, it works. We are a clinic-based, appointment-only model for care right now to our student athletes. But once we continue to advance and increase our athletic activity and introduce contact drills in our sports, we're going to need to increase our staffing. So our human resources on campus are aware, and our athletic director and our executive vice president is aware where we're at as a staff, and we will kind of put all our efforts into fully staffing our athletic training staff. Our model for athletic training coverage in our institution with 22 sports, 500 athletes, is to have 8 certified athletic trainers. We're at half that number right now, but we will get to where we need to be.
As far as staff modifications, here at Mary Persons, I'm the only athletic trainer. So currently there's not much staff to modify. It's been more about communication with the athletes and making sure that they understand the reason that we're sort of changing things that we're doing, and making sure that they're understanding of that. And usually they're willing participants, because at the end of the day, it's about keeping them safe and healthy.
At Farmingdale State College, we used to not be a sports-specific athletic training room. We used to all work with each team. There's 3 full-time athletic trainers here, and we each used to be able to be involved in each team. So with all these COVID restrictions, we've gone to sports-specific. So each athletic trainer is only here 2 days a week and works with our teams that are practicing on those specific days.
In regards to the staffing modification, what I utilized was each team that we have on campus has 2 different athletic trainers that deal with them on a daily basis. The main reason was that the last thing I wanted was if one of my staff or a student athlete were to actually test positive for COVID and it would get traced back to the athletic trainers, we didn't want to have a team not have any athletic trainer present for them. So what I did was I have it set up where each of our athletic trainers deal with at least 2 different teams, so that there is a backup in case there were to be a positive case in that team.
Right now we're trying to keep our staff spread out as much as possible. We're trying to limit the interaction between staff members, just in case there was a case of COVID on campus and our staff members would have to get isolated or quarantined. We want to make sure that we spread everyone out as much as possible, social distance, follow CDC, local and state guidelines, and make sure that our staff stays safe.